The Compliance Perspectives podcast is sponsored by Case IQ, a global provider of whistleblowing case management and compliance solutions. Learn more at caseiq.com. Welcome to the Compliance Perspectives podcast. I'm Adam Turteltaub from the Society of Corporate Compliance and Ethics and Healthcare Compliance Association. Joining us today from Chicago is Leyla Erkan. Leyla is Global Healthcare Compliance Leader for Protiviti. And today we're going to be talking about a recent report that they issued entitled Top Compliance Priorities for U.S. Healthcare Organizations in 2025. Leyla, thanks for joining us. First, can you tell us how the research was conducted?
I sure can. Thanks, Adam, for having me today. So healthcare is a strategic industry within Protiviti, and we have a healthcare center of excellence that gathers industry insights for knowledge sharing and our own, frankly, solution advancement. And the idea is to help us deliver healthcare specific best practices and thought leadership. And, we obviously also have the privilege of having hundreds of clients. So the luxury with that is being able to understand what the industry and the market is focusing on. So by combining our healthcare center of excellence and with our clients, it allows us to keep a strong pulse on what those top compliance priorities are for healthcare organizations.
So the report had some very interesting findings, and I thought it would be good if we used the balance of the podcast to go through them. On the provider side, it identified 4 key compliance priorities. First was management of emerging technologies. Are we talking AI, other technologies, or both?
We're talking both. AI, telehealth platforms, wearable health devices, all of which, as we know, hold really great promise for improving patient care, reducing costs, and enhancing operations. However, there's also an introduction of complex regulatory challenges, and it raises important ethical issues that need to be addressed to ensure their responsible use. These technologies, as we all know, evolve very quickly and more quickly than the regulatory frameworks that govern them. So a lot of this is uncharted territory. And I think it's important for compliance professionals to broaden their skills and knowledge bases to really fully grasp these risks with emerging technologies, as these really aren't the traditional compliance risks that we're used to. And given that these technologies have truly the capability to revolutionize healthcare, it's necessary for compliance professionals to have much more foresight as possible to be able to effectively and efficiently address those risks.
And as you rightly point out, those risks do evolve very quickly. Now, the second area you cited is privacy and data security, which of course is not a new challenge, but a continuing one. Where are organizations struggling?
Yeah, I would say, right of access. So organizations are still struggling providing patients with timely access, even denying access to their information in some circumstances. And, the Office for Civil Rights continues to penalize healthcare organizations for violations of the HIPAA right of access, and frankly, the most recent one just a few weeks ago. So if an organization is already struggling with right of access, it's going to make it that much more difficult for them to comply with more restrictive state laws. And we're going to see much more of that coming through. And also any changing rules in this space, such as the reproductive health information. There's attestation requirements and other things that makes it much more difficult to comply with. I would say the other thing is around data governance. As big data becomes much more integral to enhancing patient outcomes, the protection of that data becomes even more difficult. Organizations tend to be evolving their strategy and how to effectively use data for enhancing care engagement. So as more advanced tools and technologies are deployed, managing those associated risks effectively and ensuring regulatory compliance, it's just making it harder for organizations. And related to that, I would say, data access, business associates, third-party risk. There's a lot of data in healthcare. We all know that. And just understanding the systems that house data and who has access to them and what data they have access to just continues to be difficult for organizations. Also, vendor relationships change quickly. One day a vendor may have access to data, another day they might, or the data sets that they have access to changes. And so given that organizations have thousands of vendors, which it can be very difficult, as you can imagine, to get your arms around. And then I'd probably say, last but not least, I'd be remiss without mentioning data protection and incident response, given that data breaches are so common these days. Organizations are still not prepared to be able to respond and act quickly to potential threats. This is obviously where, regular testing and tabletop exercises become critical for organizations. A lot of these areas that we see organizations struggle with overlap with some common themes where we see in the proposed HIPAA security rule updates, which will have significant impact to organizations should they become final.
Let's move on to the third area you identified, which is quality and safety compliance. What's happening there?
We've historically seen compliance program guidance mention aspects related to quality of care and patient safety, though the focus was primarily around compliance with regulations, preventing fraud, waste, and abuse. And that's, of course, still the case. But given the recent OIG general compliance program guidance, they're pretty explicit in that organizations are expected to incorporate quality and patient safety oversight into their compliance programs. So there's much more emphasis on quality and patient safety being viewed as a compliance risk for healthcare provider organizations. And we see this further even with the OIG's nursing facility segment guidance that this just came out. And it reflects OIG's position that there should definitely be collaboration, integration between compliance and quality programs. And these areas do extend beyond traditional compliance program oversight and do, in some cases, require clinical or other specialized expertise that we haven't seen in compliance. And so today we are seeing more and more and expecting to see more compliance working with quality and safety to review outcomes, area of risks, improvement opportunities, and efforts to mitigate that risk, such as auditing and monitoring. And so compliance now is having topics on their work plan to support quality and patient safety.
It's been interesting seeing quality and safety move more and more into the compliance realm. So finally, you identified billing and coding compliance as one of the key priorities for 2025. Is it new issues there or just persistent ongoing ones?
I would say both. We continue to see cloning of documentation as a significant source of compliance risk, which of course can drive other areas of continued risk, which is lack of documentation to support, a diagnosis or medical necessity. We also continue to see issues around upcoding. So these aren't new issues, just what I would call persistent ones. And this can be of, I think, particular concern for organizations implementing new technologies like automated coding, because if the technology or underlying logic incorrectly somehow captures, for example, a higher dollar CPT, an organization can go a long period of time without realizing a trend of upcoding, for example, potentially resulting in an overpayment significantly. And I think this dovetails into what I was talking about before, is new issues that we're seeing related to coding and billing compliance would be AI in the clinical documentation and coding space. Again, uncharted territory that organizations need to be mindful of those potential compliance risks. Other newer issues that we're seeing would be telehealth services, especially mental health services, due to shifting requirements tied to the expiration of the PHE. I'd say we're seeing increased audits, denials related to sepsis claims, especially those with short length of stay or no significant comorbidities and complications. The new complex care management code, G2211, there's a lack of clarity on the appropriate use of the code. There's a trend to kind of overuse the code, especially by those providers who don't typically maintain a longitudinal care with the patient, such as a specialist. And then I would say billing for gender affirming care for those minors in states where those services are banned. We're seeing that pop up. So just a few relatively new issues we're seeing.
always so many new issues in compliance, and yet the older ones tend to persist as well, making it always a challenge. Well, Leyla, thank you so much for sharing these insights with us today. I want to thank all of you for taking the time to listen. I'm Adam Turteltaub from SCCE and HCCA. I hope we were able to expand your compliance perspective.